Look at something across the room right now, a clock on the wall, a word on a label, the face of someone you love. Is it sharp, or is there a soft haze around the edges that wasn't there 5 years ago? If you said haze, you're about to hear something that almost no eye doctor and almost no nutrition expert is going to tell you. The problem causing your vision to fade is not your eyes. It is not your blood sugar either. It is your neck. And the reason almost no one connects those two things is the reason this channel exists. I'm Dr. James. I've spent 15 years studying how the body fails quietly, system by system, before anyone notices. And what I'm about to walk you through is one of the most under-recognized causes of vision deterioration in adults over 50. Let me give you something concrete right at the start. A 2024 case control study from Loyola University Medical Center, published in World Neurosurgery, tracked adults with neck pain and found a direct, statistically significant association between forward head posture and posterior circulation strokes, the kind of strokes that affect the visual cortex and the structures feeding your eyes. That study, with 206 matched patients, average age 64, is one of the cleanest pieces of evidence we have linking your neck to your vision. The system profits when you stay sick, not when you get better. Your next eye appointment will not include an examination of the arteries in your neck. There is no billing code for it. The optometrist's job is to measure refraction and sell you a stronger lens. Nobody in that chain is going to sit with you and explain why the blood feeding your retina is being throttled 6 inches above your shoulders. Subscribe to Dr. James Longevity and hit like. Hit. We are working toward 10,000 subscribers, and every one of you makes this channel stronger. The system profits when you stay sick, not when you get better. That is exactly why this channel exists. Let me explain what we are actually talking about. Your retina, the thin sheet of light-sensitive tissue at the back of your eye, is the most metabolically demanding tissue in your entire body. Gram for gram, it consumes more oxygen than your brain. That oxygen does not arrive by magic. It arrives through a very specific delivery route. Blood travels from your heart up through your neck, through 2 pairs of arteries. The carotids run up the front of your neck. The vertebral arteries run up through small bony channels in your cervical spine, the parts of your spine inside your neck. Both pairs feed the brain, and one branch of the inner carotid, called the ophthalmic artery, peels off and delivers blood directly to your eye. If anything compresses, narrows, or stiffens those vessels in your neck, the eye is downstream and the eye is the first to suffer. Here is where almost everyone goes wrong. The story you usually hear is that vision loss after 50 is about the eye itself. Cataracts forming in the lens, macular degeneration in the back of the retina. Or the newer fashionable explanation, blood sugar damaging your capillaries. All of those are real conditions, none of them are wrong. But they are downstream effects. They are what happens when an upstream problem has been running for years without anyone naming it. The upstream problem, in the majority of adults over 50, with gradual vision deterioration, is reduced blood flow through the neck arteries feeding the visual system. The medical term is vertebrobasilar insufficiency, which simply means the arteries running through your vertebrae, the bones of your spine, are no longer delivering enough blood to the structures they supply. The eye is one of those structures. Before I go further, I need to name the symptoms that mean you stop this video and call a doctor today. Sudden vision loss in one eye that came on in hours, a curtain or shadow moving across your visual field, a sudden flood of dozens of new floaters where there were none before, flashing lights in your peripheral vision that come and go. If any one of those is happening, this video does not apply to your situation. You need a same-day ophthalmology evaluation. Stop watching and make the call. If what you have instead is a slow blurring that has worsened over months, halos around lights at night, vision that is sharper some days than others, vision that feels worse after sitting at a desk for hours, vision that improves slightly when you stretch your neck. That is exactly what I am about to explain. Let me walk you through the mechanism in plain language. Your cervical spine, the 7 vertebrae in your neck, contains a set of small bony channels called the transverse foramina. The vertebral arteries thread up through those channels on each side. They are surrounded by bone for most of their journey upward. That arrangement is elegant when the bones are healthy and the soft tissue around them is supple. But it becomes catastrophic When those bones develop arthritis, when the discs between them collapse, or when chronic forward head posture, the position your head sits in when you've been looking at a screen for 30 years stretches and compresses those vessels day after day. An adult head weighs about 11 pounds when held in neutral position over the spine. Shift the head forward by an inch, the load on the cervical structures roughly triples. Shift it forward 2 inches, 4 to 5 times. Most adults over 50 have been carrying a chronically forward head for decades. The neck arteries pay the price. When vertebral blood flow drops, the brain compensates by prioritizing the most critical structures: the brainstem, the cerebellum, the visual cortex. The eye, sitting at the end of a longer arterial chain, gets less than its share. The retina, the most metabolically hungry tissue in your body, is suddenly running on a reduced fuel line. The photoreceptors, the cells that convert light into the signal your brain reads as vision, work less efficiently. Visual signals become less crisp. Contrast drops. Reading gets harder. Halos appear around point sources of light at night because the retina cannot process bright contrast quickly enough. And the data on this is not soft. A 2024 systematic review published in the Journal of Osteopathic Medicine found that visual dysfunction, including blurred vision, accounted for almost 18% of all reported symptoms of vertebrobasilar insufficiency. Almost 1 in 5 patients with reduced flow through these neck arteries presents with a visual complaint. That is not a side effect. That is the second most common manifestation of the condition. And here is the part that confuses millions of people. The eye itself, on a structural examination, may look normal. The optometrist sees no obvious disease. The prescription is updated, and the vision keeps deteriorating because the prescription is not addressing the actual problem. Now let me walk you through the 5 mechanisms by which neck dysfunction is degrading your vision right now. The first mechanism is vertebral artery compression. Arthritic changes in the cervical vertebrae, particularly between the 5th and 6th vertebrae, narrow the bony channel the vertebral artery passes through. Blood flow drops, especially when you turn your head. A 2019 systematic review in the Journal of Orthopedic and Sports Physical Therapy, covering 31 studies and over 2,200 participants, documented exactly this. Specific positions and movements of the head and neck measurably alter blood flow velocity and volume through the vertebral and internal carotid arteries. Many people with this pattern notice their vision is briefly worse after turning to look at something quickly, then improves a few minutes later. That brief blur is not random, it is a transient ischemia. It is your vision system experiencing a small interruption of oxygen delivery. Repeated thousands of times across the years, those interruptions accumulate into measurable retinal dysfunction. The second mechanism is forward head posture. The chronically forward head does not just compress arteries, it also overstretches the sympathetic nerve chain that runs alongside the cervical spine and regulates blood vessel tone in the head. When that nerve chain is irritated, the small vessels feeding the eye fluctuate erratically. Pupils respond inconsistently. The eye's automatic focusing system, called accommodation, becomes sluggish. People describe this as eye strain. The cause is upstream in the neck. The third mechanism is venous drainage failure. Blood does not just enter the eye, it also has to leave. The veins that drain blood from the eye and the brain pass through the same neck structures. When those structures are tight, scarred, or arthritic, drainage slows. Pressure inside the eye rises subtly over time. This is one of the underappreciated contributors to elevated intraocular pressure, the primary risk factor for glaucoma. Most discussions of glaucoma focus on production of fluid inside the eye. Almost no one discusses the drainage path that runs through your neck. The fourth mechanism is autonomic dysregulation. The vagus nerve, the longest cranial nerve in your body, passes through your neck and helps regulate the parasympathetic nervous system, the rest and repair branch of your nervous system. When neck dysfunction irritates the vagus, parasympathetic tone drops. The eye depends on parasympathetic activation to constrict the pupil, focus on near objects, and maintain tear production. Reduced parasympathetic tone shows up as dry eyes, difficulty reading fine print, and a vague sense that the eyes are working harder than they should. This is almost never attributed to the neck, because almost no clinician thinks to look there. The fifth mechanism is sleep position. The position your head sits in for the 8 hours you spend sleeping has more cumulative effect on cervical blood flow than the position you hold during the day. A pillow that pushes your head forward, a mattress that allows your shoulders to sag, sleeping on a stomach with the head twisted to one side, all of these compress vertebral blood flow during the exact hours when the retina is supposed to be repairing itself. Photoreceptors do their primary maintenance during deep sleep. If they are starved of blood flow during that maintenance window, the repair is incomplete. Morning vision is worse than evening vision in a meaningful subset of people. And the cause is on the pillow. Consider someone I'll call Robert, 62 years old, retired engineer, sharp mind, no diabetes, no high blood pressure. He went to his optometrist 3 times in 2 years, each time a stronger prescription. The optometrist found no retinal disease, no cataract progression, nothing structurally wrong. Robert was told his vision change was just aging. Robert is not the kind of man who accepts that explanation. When he sat in front of me, I did something his optometrist had never done. I asked him to turn his head slowly to the left. He winced. To the right. He winced again. I asked him about his sleep position. Stomach sleeper for 40 years. Head turned hard to the right every single night. I asked him to describe his work setup. 2 monitors, both positioned slightly below eye level, forcing a forward head tilt for 8 hours a day for 30 years. His fasting glucose was perfect. His cholesterol was textbook. His blood pressure was excellent. Everything the eye doctor and the primary care doctor had measured was normal. What was abnormal was something neither of them had thought to check. The vascular supply to his eyes was being throttled by a neck that had spent 4 decades in a position it was never designed to hold. Robert worked through the protocol I'm about to describe for 10 weeks. The afternoon blurring was noticeably reduced inside 3 weeks. The halos around lights at night reduced significantly by week 6. His next ophthalmology exam showed no further deterioration. Not reversal, but the deterioration had stopped because the upstream cause had been addressed. How old are you right now? Drop your decade in the comments. Your 50s, 60s, 70s. That tells me exactly who this channel is reaching and which protocols to prioritize next. Your future self is watching. Now, the protocol. Step 1. Identify your head position right now. As you watch this video, where is your head sitting relative to your shoulders? If a line dropped from your ear, would it land in front of your shoulder or directly on top of it? Almost certainly in front. That is the position to retrain. Throughout the day, every time you remember, draw your chin straight back, not down, straight back, as if you were trying to make a double chin. Hold for 5 seconds. Release. Repeat 10 times. Do this at least 5 times a day for the first month. It is called the chin tuck, and it is the single most effective movement for restoring neutral head position. Step 2. Sleep on your back or your side, never your stomach. If you are a stomach sleeper, you have been twisting your cervical spine for 8 hours every night, decade after decade. The transition is uncomfortable for the first 2 weeks. Use a body pillow against your front to discourage rolling. Your neck arteries will spend 8 hours a night in a position that allows full blood flow instead of compressed flow. Within a month, your morning vision quality will be noticeably better. Step 3. Choose a pillow that keeps your head in neutral alignment. The pillow should fill the gap between your shoulder and your head when you lie on your side. No more, no less. When you lie on your back, the pillow should support the natural curve of your neck without pushing your head forward. A pillow that is too thick, too thin, or too soft sabotages 8 hours of repair every night. This is not a luxury. It is a medical investment. Step 4. Once an hour during any sitting work, perform the wall test. Stand against a wall with your heels, your tailbone, and your shoulder blades touching it. Now press the back of your head against the wall. For most people over 50, this is uncomfortable or impossible at first. The position you cannot easily reach is your neutral head position. Practice reaching it. Hold for 30 seconds. Repeat through the day. The discomfort is your evidence of how far your head has drifted forward. Step 5. Stretch the sub-occipital muscles, the small muscles at the very base of your skull where it meets your neck. These muscles are chronically tight in almost everyone over 50 who has worked at a desk or used a phone regularly. To release them, sit upright. Lower your chin slowly toward your chest and place gentle pressure on the back of your head with both hands. Do not pull aggressively. Just rest the weight of your hands for 30 seconds. You will feel the stretch at the very base of your skull. Release. Repeat twice. Do this in the morning and the evening every day. Sub-occipital release improves vertebral blood flow within minutes. Step 6. Add 1 targeted nutritional support. The retina needs adequate magnesium to maintain vascular tone in its small vessels. The majority of adults over 60 are insufficient in magnesium and have no idea because magnesium's not on a standard metabolic panel. A handful of raw, unsalted pumpkin seeds in the afternoon, about 30 grams, delivers a meaningful dose of magnesium in a highly bioavailable form. This is the one place where the pumpkin seed advice you have heard elsewhere is correct, but the mechanism is not what you were told. The seeds do not fix your eyes. They support the vascular tone of the small vessels feeding your eyes. The neckwork above is what restores upstream flow. The seeds support downstream vessel quality. Both are required. Here is what to do tonight. 5 steps, 10 minutes a day. 1. 10 chin tucks. Right now. Pause this video. Do them, come back. 2. If you are a stomach sleeper, set up your bed for back or side sleeping tonight. Use a body pillow. 3. Evaluate your pillow. If your head is not in neutral alignment, replace it this week. 4. Do the sub-occipital release before bed, 60 seconds. 5. Buy raw, unsalted pumpkin seeds tomorrow, 30 grams a day in the afternoon. The vision deterioration you have been carrying for years is not a verdict from your eyes. It is a report from the structures above your shoulders. The eye is downstream, the neck is upstream. The optometrist's job is downstream. The work this video describes is upstream. That is why you have not heard it before. I'm Dr. James, and I've spent 15 years watching people get stronger prescriptions while the real cause of their deterioration sat untouched 6 inches above their collarbone. No one sitting in a white coat in a standard eye clinic is going to walk you through the cervical mechanics of vision loss. There is no billing code for 10 minutes of neck assessment in an optometry visit. The healthcare system generates revenue from lenses, procedures, and prescriptions, not from patients who solve their problems at home with correct information. That is exactly why this channel exists. Subscribe to Dr. James Longevity and hit like. Every subscriber moves us closer to 10,000, and every one of you who shares this video is helping someone else get the real answer instead of a stronger pair of glasses. Watch this next. The 7 posture mistakes silently aging you after 50. Link on screen, right now. Science first, protocol second. What this actually means for your body, always. This is Dr. James Longevity. Subscribe and turn on notifications. Your future self is watching.